Welcome back to VetCare. Today, we're going to understand abnormalities of testicular descent and female reproductive tract development. Let's talk about common abnormalities related to testicular descent in animals. Normally, the testes develop inside the abdomen and later descend into the scrotum before or shortly after birth. But sometimes, this descent doesn't happen properly, and this condition is called cryptorchidism. In cryptorchidism, one or both testes fail to descend into the scrotum. If only one testis remains inside the abdomen, it's called unilateral cryptorchidism. In this case, the descended testis in the scrotum functions normally, it produces sperm and testosterone, while the retained testis inside the abdomen becomes small, inactive, and infertile. If both testes fail to descend, known as bilateral cryptorchidism, the animal becomes sterile because sperm cannot develop at body temperature. However, male characteristics still appear normally, because testosterone is still produced. Another related condition is inguinal herniation. This happens when a portion of the intestine slips through the inguinal canal and enters the vaginal cavity or scrotum. This occurs because the vaginal process is directly connected with the abdominal cavity, allowing intestinal loops to move into the scrotum. Now let's move on to an abnormality in the female reproductive system, known as Freemartinism. Freemartinism is seen mainly in cattle and happens when a cow gives birth to twins, one male and one female. In such cases, the placental membranes of both fetuses fuse together, forming a shared blood supply. This means both twins are exposed to the same hormones. Since the male's testes develop earlier, around day 40 of gestation, they start producing testosterone and anti-Müllerian hormone. These hormones enter the shared blood supply and reach the female twin. As a result, the female's reproductive tract fails to develop properly, the paramesonephric ducts regress, and the ovaries and uterus remain underdeveloped. This makes the female twin, called a Freemartin, sterile. However, the male twin usually develops normally and remains fertile. These are important reproductive abnormalities every vet student and practitioner should understand. If you found this helpful, don't forget to like, share, and subscribe for more simple and clear veterinary lessons.